Hey everybody, welcome to Take on the Lake with Lake Expo. I'm Nathan Bechtold, and I've got a bonus episode for you today. This one's pretty short and an interview that I got to have after a really huge announcement that was made at the lake pretty recently. So Lake Regional Health System, which is like the major healthcare provider at the lake, and you know Lake Regional Hospital here in Osage Beach, they announced that they have become part of the Mayo Clinic Care Network. Now, you've probably never heard of that, just like I had never heard of that. But what that literally means is that Mayo Clinic is essentially kind of behind the scenes for Lake Regional, and all of Lake Regional's doctors and diagnoses and all that stuff. They have Mayo Clinic folks to rely on, everything from difficult cases to training and all kinds of other things. So huge announcement, because there aren't that many health systems that are actually part of this Mayo Clinic Care Network. So a really big deal. And at the announcement, after as people were buzzing around and after the banners unfurled and the confetti went everywhere, I got a chance to talk with Lake Regional CEO Kevin McRoberts and Mayo Clinic Care Director Mark Larson. They sat down with me there in a room at Lake Regional, and we had a pretty cool chat and kind of unpacked a little bit more about what that means, why that's a big deal for the lake, and why it's really, really great news for people who live at the lake, who visit the lake, or frankly, even people just who live throughout Missouri. As they say, basically, this is going to make the lake increasingly a healthcare destination. It really turns up the dial in a big way at Lake Regional. So I hope you enjoyed this conversation. I thought it was a really enlightening interview with Lake Regional CEO Kevin McRoberts and Mayo Clinic Care Director Mark Larson. Enjoy.
If I could direct your attention.
Hey, Nathan with LakeExpo.com, and I'm here with a really exciting interview. I'm here with representatives from Lake Regional Health System and the Mayo Clinic talking about an amazing announcement, actually, that they made today, and we're going to talk about that for a minute and ask a few questions. So you guys just introduce yourselves.
Good morning, my name is Mark Larson. I'm a gastroenterologist and medical director for the Mayo Clinic Care Network.
Great, and?
I'm Kevin McRoberts. I'm the CEO here at Lake Regional Health System.
Very good. Well, Mark and Kevin, thanks for taking a minute to chat with me. So you guys made a huge announcement today that Lake Regional is joining the Mayo Clinic Care Network. And this is, well, actually, let's get one thing right out of the way. This is not an acquisition.
Correct. This is
I think people will want that clarity.
Not an acquisition, not a partnership, not a merger of any type, not
Right.
technically even an affiliation. It's just an opportunity for two organizations to work together to care for patients.
Great. That's good, because I think that people automatically think that when they see, especially a really big nationally known brand being announced at a little place like Lake of the Ozarks. This is an opportunity to connect Lake Regional to a massive sort of set of resources, basically. Is that the right way to say that?
Correct. And it connects our physicians to the Mayo Clinic physicians. I believe, Dr. Larson, if I'm not mistaken, you guys have over 9,000 physicians?
I'm not sure the exact number, but it's at least over 6,000 at 3 different sites and about 82,000 employees. So it's a very large organization, all dedicated to healthcare.
Yes. Yeah. So it allows our physicians to connect to the Mayo Clinic physicians, their resources, their knowledge, their experience. And so as our patients come, local patients and patients from the region to seek care here, it allows us to tap into that depth and breadth of knowledge that Mayo Clinic brings to the table.
Mayo is a really big name.
It is.
How did a big name like Mayo get connected with our little community at Lake of the Ozarks?
Well, I will tell you, Lake Regional is an amazing health system. And I think if I could brag for a second, we're probably one of the best kept secrets in the state of Missouri. But we're always looking to improve, and we're always looking to strive for excellence in delivering high quality health care. And so as we've been on our quality journey, we wanted to emulate and reach out to the best, and that led us to Mayo Clinic. And so as we started talking to Mayo Clinic, we learned very quickly that they have programs and services that could help us on our quality journey. And over the course of that time, we were able to get to know the folks at Mayo Clinic, work with them very closely, our cultures are very similar and very aligned. And because of that, it seemed like a very natural relationship, and henceforth led us to where we're at today to make this announcement that we've been invited to be part of a very unique, select group of hospitals across the world.
And it is pretty unique and select. I heard you talking about that earlier. There's how many approximately hospitals that are even
Approximately 38 hospitals domestically and 11 internationally.
Okay, so that's a very elite group.
It is.
Pretty cool.
And I think that's what we really want. We want to get the message out to let people know that Lake Regional here at the Lake of the Ozarks, one of the things we ask ourselves as we went on this journey is why not here? Why not Lake of the Ozarks? And as you mentioned earlier, as we were discussing about the fact that the lake is a destination community, Lake Regional can be a destination healthcare provider as well. People come here, they vacation here, they move here, and we want them to have the confidence and the trust that there's a healthcare system here that can provide for them in their time of need.
I think that's really cool that folks who are either live at the lake in the lake area or in Missouri, like you're saying, I mean, destinationally, if you want, I don't know, is it right to call it Mayo level care, but at least access to Mayo level wisdom and expertise, then this is a place to come.
I think your point's right on. Being able to share knowledge and expertise, we can collaborate bi-directionally. We learn from providers wherever they are, how they care for patients. Your providers in this area know their patients best. They know their unique needs, their family structure, their socioeconomic situation. They know their patients best. But healthcare is complex.
Right.
And so to get that specific treatment plan for a cancer or a heart condition might be something where we all need a little help, knowledge, expertise to care for the most complex patient. That's what this relationship can offer.
Two other quick things. One, are there any, they don't have to be, but are there any key areas where you go, man, this is an area where we have so much wanted help? Maybe it's cardiology or oncology or something. Are there any key areas that you think you've really been seeking a kind of depth that Mayo can provide? I mean, I know it's all of them. But
yeah, and you're right. It really is across the board. It's the full gamut of services, etc. Lake Regional is we are designated by the state of Missouri in stroke, STEMI, which is heart attack, and trauma center. We're the only one between Columbia and Springfield, Missouri that can claim that designation. And so we're very proud of those programs. But one thing when you look at cancer and you look at how rapidly cancer is changing, the treatment plans and the medications or drugs coming out for cancer, it's going to be very, very, very nice to have that relationship with Mayo Clinic. Clinical trials, tumor boards, where we get physicians collaborating together on what's the best treatment. I think Dr. Larson alluded to that earlier about a cancer patient who may need surgery. Those are things that, hey, before you cut, we can try to get a second opinion, make sure we're doing the right thing.
That's great. That's great. One other quick one is, I don't know the answer to this one. So why should employees, Lake Regional is one of the largest employers in the lake area. So why should employees in particular be excited? I don't know if there's training or there's just the connection level. Why should employees at Lake Regional or people seek to become employees now that this relationship is being established?
I'll jump in. There's not only access to medical knowledge, but also to administrative knowledge, nursing knowledge, best practices in all areas. So whatever Lake Regional wants to ask Mayo Clinic about, whether it's a protocol for care, whether it's a protocol in the business department, whether it's a revenue supply issue, they can tap into anyone at Mayo Clinic who's a subject matter expert to help them with their administrative or nursing or any area. So we're a large institution. To be able to share that knowledge with Lake Regional, we hope will really lift the Lake Regional team to do whatever they want to do, accomplish whatever they want to accomplish.
Well, thank you guys so much for sitting down. This is indeed an exciting day, and
Thank you.
And I think the lake community and really Missouri, people who visit the lake outside of Missouri, really, because a lot of people come here from outside the state are going to benefit from this relationship. So thank you guys.
Thank you very much.
Congratulations.
Thank you so much. Appreciate it.